At CBF, we know that for you to change your body, you need to change your mind. Exercise and eating healthy is only part of the plan. We care about our members as we care about our family because our members become our family. It is not about competition, but support. It is not about being the strongest or the fastest, but about you defeating your negative self. It is about working together and making the task challenging and have fun. By the end, what matters is not how hard the session was, but that you take control of your mind so you can take control of your body. My name is Sandro Torres, and I'm happy you are part of our family. Welcome to Custom Body Fitness. Today we're going to be talking about something that many people for getting results, stay active and exercise. We're going to be talking about pain. Actually, the fear of the message that you get from pain. That's what we're going to be talking about. I have been exercising for 22 years. In those 22 years, I have experienced all kinds of pain. From knee pain, back pain, lower back, upper back, neck pain, elbow pain, forearm pain, feet pain, all kinds of pain, acute pain, intensive pain, the continuously pain, no pain, sharp pain, all those pains. But I never have to go and see a doctor, never have to have any professional to look any of those pains, because those pains are normal. Usually, I should say, I have seen some professionals such as chiropractors and massage therapists. That's most likely what I need when I get those kind of pains, and I will explain more about that in a minute. I have hurt myself to the point that I can't walk, I can't sit, I can't stand up. It's very painful, and one of them, and you relate to that if you do weightlifting, is a lower back pain. It's very painful to the point that I can't lie down, I can be walking, I can be sitting, and it's intensive and it's continuous. It's there. That's the reason why it's so painful. I'll give you more details about that in a minute. This give me the courage and motivate me to learn more about these issues, these kind of pains that we get when we exercise. If why we get them, if it's something that we really need to pay attention and see what we can do ourselves, or we need to go to see a doctor or professional to avoid any debilitating injury or anything that we don't want, such as hurting our back. Like not like this kind of hurt, like really herniating this or things like that. So this is what we're going to be talking about here. The first thing that we're going to be talking about is going to be muscle triggers, also known as muscle nuts. What are those? Those things are muscles that become very tight. We usually get those because these muscles are trying to compensate for other muscles that don't have the strength to do the exercise, and we create an imbalance. And because they are contracting very often, it comes to the point they become very tight to protect your body. These muscle triggers don't happen overnight. As you start lifting weight little by little and those muscles start compensating, like I said, they become very tight, and all of a sudden you get a big knot on the back and they're not properly working, and that's how they become knot, and that's when they start becoming very painful. Those muscle triggers usually happen on your upper back, right here on your neck, between your scapulas, your lower back. Those are the areas where it happens the most. When it happens on your neck, it's difficult to turn your neck to your right or to your left. Probably you have experienced that. When it happens between your scapula, it's kind of similar, but it's not as intense on your neck, but you feel a discomfort on your upper back. When it happens on your lower back, that's the one that I was talking about. It's when it's very difficult to lean forward. As soon as you lean forward, you feel like something pulls you back and you feel like very sharp pain. You can't be in lying down because it hurts. You can't even be sitting because it hurts. You can't be walking because it hurts. It hurts all the time. It's difficult to move. It's difficult to do anything. It's very debilitating. When this muscle trigger happens, many people think that it's a back injury such as herniated disc, which is not true. This is it's nothing else than a muscle trigger. So be aware of that. These kind of injuries are very debilitating, but it's nothing. You don't need a professional can help you, but you can take care of it yourself. There is a couple things that you need to follow to alleviate the pain and undo that muscle trigger. First is you need to massage that area. Whatever the muscle trigger is, it's gonna be very sensitive because that's where it's not. So you need to massage that area. It's painful when you massage it, so you need to undo that muscle by massaging it. Once you do that, you need to stretch it. And once you stretch it, you need to relax it. Such as you can get to the hot springs, you can get into the hot tub. You need to relax it. You need to use some kind of lotion that muscle relaxations and things like that to help you relax and go back to its normal length. So that's what you need to do when any of those muscle triggers happen. Depending on the severity of that muscle knot is how long it's gonna take you to get back to normal. For example, to me, when it happens, sometimes I massage it right away and then I stretch it, and in 2-3 days I'm back to normal. However, sometimes it takes me a couple of weeks before the pain is completely gone. Back in the past, when I didn't have this knowledge, it used to take me up to 3 months before that muscle trigger was gone, because I didn't massage it. I tried to stretch it, but I didn't. Even though if you stretch it and if you don't massage it, you don't get the same benefits. So it's very important that you massage it so you get back to normal as soon as possible. Alleviate that pain and undo that muscle trigger. To avoid that, make sure when you lift weights, make sure you're in a proper form, make sure your muscles are working evenly so those muscles don't compensate when you're exercising. Now, once you fix that problem, the next step to do is when you're lifting weights, make sure your form is good. Once again, make sure those muscles are not compensating. The next pain that we're going to be talking about is muscle tightness. Your body is going to become tight because you're using it all the time. You're using it, if you're active, even if you're not active, you're sitting in the chair, in the computer, your muscles are contracting there. When you're walking, if you're bagging stuff, when you're skiing, when you're doing anything, especially if you are very active, those muscles start becoming very tight. People complain a lot about knee pain, forearm pain, feet pain, all kind of joint pains usually are because there is a lot of muscle tightness. When your muscles become tight, those ligaments and tendon around the joints become very tight. And when they become very tight and you try to flex those joints, the muscles start hurting. So it's not your joints that hurt, your muscles around start hurting. Usually elderly people are tight and they're hurting, but they're not hurting and they're tight because they're hurting and they're tight because they don't stretch. So if you want to avoid these kind of pains, it's very important that you stretch. It's super important that you find a yoga, a stretching routine that you do continuously in your life. If you start getting these pains, if you want to avoid these pains, same thing. Get a routine, of stretching exercises for you to get rid of any joint pains because of tightness. So now we're gonna be talking about the serious injuries. Serious injuries are three that I have in mind. One of them is a broken bone, two is a disc herniation, and three is a sprained ligament. Those are three things that you really want to go and see a doctor if it happens. When you lifting weights, when you exercising in the gym, usually if you are doing a great form, if you keeping your form correctly, and if you lifting the correct weight that you can lift, it's very difficult for you to break a bone. It's very difficult for you to sprain a ligament. It's close to impossible. And it's difficult for you to herniate a disc. Usually these things happen when you're not doing this properly. Here is a great example. Let's talk about the knee a little bit. The knee is two bones that are attached together, the femur and the tibia. They attach like this, and you have four ligaments, two that are crossing and two that are on the side, the collateral and the medial. It's of course, the ones that are crossing is the anterior and the posterior cruciate. Those are the main ligaments. There is other small ligaments in there, but those are the main ligaments. So the knee is made to flex and extend. That's it. It's not made to do anything else. When people usually sprain a ligament is when they twist. When they do this, the knee is not meant to twist. If you pay attention, most people who get a sprained ligaments are people who are twisting. Skiers do it very often, soccer players do it very often, football players do it very often, tennis players do it very often, skaters do it very often, and the reason is because there is a lot of twisting motions on those sports, and that's the reason why they sprain that. In the weight room, there is no twisting motion when you're lifting weight. When you're doing any exercise, it's only flexion and extension. So it's very difficult for you to sprain a ligament. The same with your bones. It's difficult for you to break a bone unless you're doing something in the wrong way. Unless you let a big weight fall in your bone in the wrong position, it's gonna break. So for you to injure yourself in the weight room is very difficult. So keep that in mind unless you're doing wrong things or you have an accident. Of course, it can happen. So those are the things that I think: a broken bone, a herniated disc, or a sprained ligament. Those are the things that you want to see a professional to fix that, to get surgery and things like that. But most likely what you're gonna get in the gym for the weightlifting that you do, the pains that you're getting, is most likely a muscle trigger or a muscle tightness. Those are the two things that you need to worry about, and those things you have a treatment to follow. It's most likely, once again, you want to massage the muscle trigger, you want to stretch, and you want to relax. And of course, it's gonna take time for that to happen. Don't let any of those pains stop you from exercising and for continue getting to your goals. I recommend our members, when they get a muscle trigger or tightness, to take care of that, but actively recover. It's very important that you don't stop. It's important that you continue moving those muscles. It's important that you continue moving, and it's important for you to stay active. The more active you are, the more you use those muscles in the correct way, the faster you're going to recover. There is research. I have studied a lot about this topic. I have read a couple courses, and every professional do recommend that you stay active to recover faster. So that's it for today. I hope you like this talk. Please like, share with people who are afraid of pain. Pain is okay. Remember, you in the gym, you in life, you're gonna hurt yourself. It's like going to the river and not wanting to get wet. Of course, if you're in the river, the probability for you to get wet it's gonna be very wet. It's gonna be very high. So if you want life, you're gonna hurt yourself. They're not chronic pains. It's something that you can fix. So don't be afraid of it. It's okay to have a little bit of pain. You can fix it. Continue with your program. Don't stop living your life. Continue moving forward. That's the message. So please share it with people who needs this message. And thank you so much for continue following us. And I'll be tuning in the next time.
Thank you so much for taking the time to watch this video. If you enjoyed the content offered here, then I know you will enjoy these books. These are great tools to lead you to successful weight loss, better health, and greater happiness.